And we are live today here. I'm so excited. My name is Morello Kane, and we are going to really touch bases on a lot of different hair issues. I am a master cosmetologist for over 20 years in the hair industry. My passion is hair care. And I have with me today, I'm so very honored to have her with me, Dr. Nikki Hill of SOCAH Center. Dr. Nikki, how are you?
I'm doing very well. Thank you. Thank you. And thank you for having me today, Ms. Morale. I'm excited to be here.
Oh, absolutely. And so let me just say that Dr. Nikki has been extremely busy today. I tell you guys, and I thank you for making the time out, Dr. Nikki, because she had a hair transplant to do today, which is very extensive. Is it, Dr. Nikki?
Yes, ma'am. That's typically about a 6 to 8 hour procedure. Very tedious.
Wow.
It's where we take hairs from the back of the scalp and we implant them either on the top scalp, the crown scalp area, or around the frontal hairline to restore edges.
Wow. Oh, wow, Doctor. Okay, so now, am I a candidate for that? Let me just because I'm needing and so would I be an ideal candidate for that?
And that's part of the process. When I have my consultations with patients, we have to make sure if they're a appropriate candidate for any treatments that are offered in my practice. Personally, we have been consulted, and I've consulted you on your hair concerns in the past. And I think there are other options and other choices and treatments that you may be better benefited from than going all the way to surgery.
Okay.
In my opinion.
Oh. So let me say this, Dr. Nikki, and as you just said it before, she did assess me. And so and let me just tell you, it was extremely difficult. Okay. I was not comfortable at all. I trust Dr. Nikki. I did. I trust her. And so, but still walking out that process is not always comfortable. You know, so and let me just say this. And this was during my time period of when I was hitting behind hair weave when no one saw my hair for 13 years. And so I unveiled in front of Dr. Nikki, in front of my husband, but Dr. Nikki in her office, and she helped me with that process. Now, Dr. Nikki.
Yes, ma'am.
Would you say that, did I seem like I was uncomfortable?
You did. I could tell it was deeply rooted, the concerns that you had, with even showing, the vulnerability of just kind of exposing yourself and removing your unit, which for a lot of women can be a protection for them. It's a security blanket, especially if they don't know what's going on underneath the unit, if they don't understand why they're losing their hair, which translates to why am I losing part of my identity? Why am I losing who I am and how I identify and how I want to present myself to people in the world? And that's why I always have to understand in my practice and my team members, I'm constantly kind of trying to educate them on that as well. When patients come in, no matter what state of hair changes they're in, we have to take that in ultimate consideration with how they feel. Because it's detrimental to patients and to women and men, because I'm getting a lot of men coming in too now, when they're starting to lose part of their identity without answers and understanding why, especially if it's happening at a fast pace and especially if it's been going on for a long time. And so I definitely understood your concern and your hesitation and the vulnerability in that state. And then when you took off your unit, I was like, what we crying for? We had the prettiest little hair. But again, like I said, we can laugh about it now, but it's in the moment. Like I said, I understand.
Devastating.
And not everyone has the ability to be able to go to take off a unit and be able to have hair under that unit. And so a lot of times when patients come in, I don't know what's going, like they check in, they walk to the back and they walk in as how they want to present themselves. And the door closes and the unit comes off. I see them and I know they feel exposed because they don't want to make eye contact. Sometimes their demeanor changes. Sometimes they're quickly asking, do we really need to take photos? Which we take photos for documentation because we don't know if something's going to get better and if there's going to be growth in it, so we
Right.
physically can see it. Because I'll tell patients, trying to watch your hair grow and see if it's growing day by day, it's like trying to see when paint dries. It's just hard to see it on
Yes.
a daily basis. So when I see patients in like intervals, I take photos so we can actually make sure objectively we're going in the right direction. But I mean, sometimes patients take off their units and there's no hair there because they've been suffering from potential scarring,
Yes.
inflammatory changes that can lead to permanent hair loss for years and years and years. And so, and there's different types of hair loss. And again, like I said, I'm not minimizing, any of the concerns you had at all, because I understand. I went through losing 50% of my hair and fast, and I mean, I'm just in there bawling and crying, and they're like, "Stop stressing, it's making it worse." And then even more hair came out because I started stressing. I'm stressing that my hair is coming out. So, I mean, I know that was a lot and a tangent to say, but yes, ma'am, I recognized and understood the concerns that you had at that time.
Let me say, I had, because as you just stated, I walked in one way, you know, Morello came to hair debate. I'm coming in and, oh, this is what I do. And yes, this is
Mm-hmm.
what I wanted to address. And it starts with me. And when you were like, okay, well, take it off. I'm like, well, hold up, you know,
Mm-hmm. Pause.
but now to do it in front of my family, it was
Yeah.
my husband, my son, and my daughter.
Yeah.
And one of the things that I have to, boy, you and your team, oh my God, so supportive. Because again, you turned me away from the mirror, so I was facing my husband, but I could still see my reflection in his eyes. And when I tell you to have to unveil in front of him, your team, well, you have already seen it, so you talk about difficult. But again, I had a whole plan. Yes, I'm coming to do this, but I'm putting back on my unit. And when I tell you the support that I got from you guys, and I was able to walk out of there, throw my wig on across the field, and walk out of there just with my hair exposed and being exposed. And that was a whole transformation I had to walk through. So
Yeah.
when I tell you, I'm so very thankful that you was definitely a part of that journey. Definitely thankful. And was even more so shocked the fact of when you said, I didn't have any scarring to my scalp. I said that's only God. Because we're talking about for
Mm-hmm.
13 years, it was covered.
Mm-hmm. Mm-hmm.
Wow.
Yes,
Wow.
ma'am.
And so now, Dr. Nikki, again, wanting to address some of these issues that affect so many women in their hair loss today. And so there are some conditions that I see that women are suffering and battling with in the salon, and so, we're talking about hormones affecting the hair. And I had a client that lost 60% of, I would say 50 to 60% of her hair. We basically had to cut her hair up to a bob, and she had to go undergo treatments for that as well. She had to see a dermatologist, and I was working with them pertaining to that. And so, to my clients, let me just say this: when this is Dr. Nikki Hill, that you are the dermatologist that I refer my clients to, for a couple of different reasons, but for the main fact of the reason, as a dermatologist, you specialize in hair care. Your passion, for me, I see that is in hair care, and you connect with how individuals, their feelings behind that. Again, you don't minimize it, and you take it very serious.
Yes, ma'am. Absolutely.
So thank.
Oh, sorry, go ahead.
No, 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 no. I'm sorry. Go ahead.
Well, I was just saying it was an honor to be part of your process. And every day, it's an honor to be able to help people, because when I was in that position, I didn't find too many dermatologists that
Mhm.
liked treating hair loss. And it's
Yes.
so common. I mean, if you've not been affected by hair loss, someone close to you that's been touched by it.
Yes.
And it's just something that's just so prevalent. And we learn about it in dermatology, but to specialize it, I
Yes.
personally did additional training and went and shadowed and interned with other dermatologists that specialize in hair loss disorders and diagnosing scalp conditions. So it's something that, I don't take lightly, and always trying to make sure we are staying on top of the newest research,
Yes.
and finding ways to really be more proactive and prevent it, and educate
Yes.
people to understand your scalp is still skin and it shouldn't burn, shouldn't be irritated, it shouldn't have bumps or be sore, things like that, and just kind of trying to identify them earlier, even to the point
Mhm.
where we want to connect with stylists so stylists can be trained and learned about and taught about how to identify just kind of some of the underlying initial symptoms people experience or what they see on people's scalp, to even say, hey, this may or may not be something, but you have like this little patch right here on your scalp, or hey, there's like this area that's looks, they say, oh, that's really sensitive or tender. Whenever you go there, don't touch that area. That's my sensitive
Mhm.
spot. No one has tender spots or soft spots after they a few months old. Yeah, you pushing in two, you should have
Yes.
more soft spots. So when people say, oh, that's always been my soft spot, my tender spot, that's not right. Something else may be going on. You
Yes.
need to identify it. Yeah.
Absolutely. I love that. I love that. So, in identifying some of these issues, let's talk about psoriasis.
Mm-hmm.
Okay. And what that looks like, and if that would be considered a contributor to hair loss.
It most certainly can. So psoriasis is an autoimmune condition. It
Hmm.
systemically causes inflammation in the body, but a lot of times in the skin is where it tends to manifest visibly. So not just like elbows, knees, knuckles, and some of those common areas, but it actually really likes going on the scalp as well. So on a lot of times, stylists, barbers, beauticians, trichologists, they're in a really great position to be able to help identify these and
Hmm.
notify their clients, because what they'll see are kind of thick white to silver scale or flaking on a scalp. It can be a little
Okay.
small patch, or it can cover the entire scalp. But
Wow.
a lot of times it likes to be on the scalp right behind the ear on both sides, and it loves
Okay.
hanging out on the lower back of the scalp as well.
Hmm.
So, and so if you ask your client, they'll tell you like, okay, and it itches a lot. It doesn't go away too easily. Like they may try to pick at it and it bleeds very easily. Um,
Okay.
and then the interesting thing about it is it's good to let your clients know if you see that, because psoriasis sometimes can cause other issues, like it can affect their joints and other organ systems,
Wow.
and it can lead to,
Really?
yes, ma'am, and it can lead to permanent hair loss. So you want to be mindful to kind of let them know that, because they can't see the back of their scalp. May know it's itchy or feels weird or feels different, like it feels like there's thick
Hmm.
skin on top, but they don't know what it may look like. And so you want to make sure they know that. And also the biggest thing, you don't want to scratch it up, because that can make it worse.
Okay. 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 So now, with the hair loss, would that be contributed to the inflammation that may be caused from the
Absolutely.
irritation of it?
Absolutely. So scalp is
Okay.
simple. Fight inflammation or grow hair. It can't do both. So if there's
Okay.
inflammation in that scalp, then it's going to cause the hairs to shed. It's also going
Hmm.
to cause the hairs to grow out of an inflamed scalp. So they grow out very weak and they break as well. And then just
Okay.
the mechanical damage from scratching with nails will break your hair too.
Okay. Oh, now let me ask you a question. When that hair comes out, will it still have the bulb on the end of it?
It can, if it's in a shed phase and it's coming out. Sometimes the bulbs
Okay.
can be black bulbs, which means they should have still been in a growth phase, but something kind of shifted them a little quicker.
Okay. Okay. Oh, note to self. Okay, guys, I'm here to tell you, if you know a hair care provider, you definitely want to share this with them, because again, the information that Dr. Nikki is sharing, we've always addressed the white bulbs that you see
Mhm.
on the end of the hair strand, but there is a such thing as a black bulb. Okay.
Mhm.
And which means that that hair has shedded prior to the phase of the shedding
Mhm.
phase, in that growth phase that it was in.
That's
Wow. That
mhm.
is very interesting. Okay. Now hormones.
Yeah.
And I actually had a client to suffer from that, dealing with hair loss and their hormones. But what is it about the hormones? Because every woman, when they get to a certain age, their hormones is an issue or could be an issue. And so, with that being said, what is it about when a woman start going through those changes that will actually cause her to lose her hair?
So anytime there's major shifts and changes in the body,
Mhm.
and stress can affect it, surgeries can affect it, internal,
Okay.
external stressors can affect it. It affects your cortisol levels, but it also can affect your hormone levels.
Okay.
So when your hormone levels shift and change, then what, like in the be, what can happen is you can go through a stress shed. But also, and whenever someone comes in with a shedding episode, we try to backtrack, figure out what happened, what shifted. But if it's something
Mm-hmm.
hormonally specific, things to consider are starting and stopping birth controls, pregnancies,
Okay.
delivery, stopping breastfeeding. A very
Mm-hmm.
common thing now is biohormone replacement therapy. A lot of women are going on testosterone replacement therapy just because
Okay.
it helps with um, perimenopausal symptoms.
Okay.
A whole bunch of other women are doing it because it helps with uh, improve sleeping. I mean, it's a lot of benefits for it. So, I mean, I wanted to go on it too, but I just unfortunately always see everybody with hair shedding on it, so it makes me a little nervous. But it has a lot of
Mm-hmm.
benefits to go on testosterone, but a lot of the pellets that they use will take someone's testosterone from single numbers all the way to triple numbers. And that
Okay.
big shift and change over even a few days can cause the hair to just start shedding like crazy. Um,
Wow.
but also with those hormone levels over time, they can start focusing in on hormonally sensitive areas. So it would
Okay.
just start having the patients may start experiencing a lot of thinning along the temple areas. They may start getting thinning along that frontal forelock area, like right behind where your
Yep.
bang sits. Um, and some patients, if it really get progressive, they'll start feeling like the whole top scalp is getting thinner as well.
Yes. Yeah, that's exactly what my client experienced, to the point where she couldn't style her bang area at all. That's when it truly hit her. And she
Mhm.
went, she broke down. Because that is devastating,
Yeah.
And but now, because of that breakage, could it actually look like heat damage in a sense, because the texture of the hair changes?
So the hairs can get a little finer. They can get a little weaker. They
Hmm.
can become a little bit more fragile and brittle, and which makes them more fragile. So
Hmm.
perimenopausal hair can definitely do that. Um, and if the hair breaks a good bit and the ends aren't trimmed, or just
Yes.
the day to day wear and tear on the hair, finer hairs aren't going to be able to withstand as much mechanical and thermal, um, uh, I guess, kind of, I don't want to say damage, but just exposure, as opposed to
Absolutely.
hair that's not hormonally sensitized.
Wow. Wow. Yes. Yes. And another physical component that affects hair loss as well, is the thyroid.
Yes. So with
It's
the
the thyroid.
thyroid, there's thyroid is a little organ located at the base of your neck, sometimes a little bit
Hmm.
higher, but typically around that area. And it's responsible for pumping out thyroid hormones. If you ever had blood work, it's the TSH, the free T3, well, T3 and T4. Um, well, really your T3, T4, your TSH comes from above. But what it does is it regulates a lot of kind of systems in the body. So feeling hot or cold, losing weight
Okay.
or gaining weight, having hair shedding or or dry or brittle hair and nails. Those can all be influenced whether your hormone levels are too high or they're too low. A lot also clients can have a lot of aggressive shedding, and they can even have loss on those outside or the lateral ends of their eyebrows from thyroid changes.
Okay.
Mm.
Wow. Okay, so what can actually be done if a person is going through that?
If someone's going through thyroid changes, well, we usually identify it by doing blood work in the office to see if they have any metabolic issues that are causing their hair changes. And usually they either have to go on a natural variant if it's not a major noticeable lab work, like they're not very high or low from the normal limit,
Mm-hmm.
then sometimes they can go on natural supplementation for the thyroid. Sometimes, if it's
Mm-hmm.
a really big shift away from the normal values, then we may need to talk to either a primary care or endocrinology
Okay.
doctor, who deals with kind of uh, organ systems that make hormones, like your thyroid.
Okay.
And they're able to put the person on a little thyroid hormone supplement to kind of help either calm down or replace the hormone levels that their thyroid is either overproducing or not producing enough of.
Wow. So now would they see that endocrinologist? It was that endocrinologist?
Endocrinologist.
Endo. Okay.
Hmm.
Would they basically see that specialist along with the dermatologist?
Yeah, so a lot of times we have to wait for the
Hmm.
levels to try to start normalizing. I'll still have treatments, topical treatments to try to stabilize the scalp so it's not shifting and shedding so much, shifting those hairs
Okay.
to a shed phase and shedding so much. Um, However, a lot of times we're just basically putting a band aid on a pipe that's leaky because we have to get
Hmm.
everything, we got to get the plumbing right, we got to get the thyroid right, or else everything we're doing on my end, we're just trying to bandage the situation.
Absolutely. Okay. 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 So now the topic at hand,
Hmm.
red light therapy. This is um well, it's new. When it well this I know that this particular treatment is not necessarily new, but the technology behind it, in which individuals can get their hands on these instruments, and I'm just like, okay, we truly need to talk about this, so that individuals can see how serious and how effective this is. But if you are not using it in the right way, if you're not trained on using it, how you can actually, it could be in a reverse effect behind it. And so what is red light therapy? Let's talk about that.
Yes, ma'am. So red light therapy, also known as low level light therapy, it's
Hmm.
using there's visible light and then there's other wavelengths of light that aren't visible. So within the
Okay.
visible light spectrum, how you remember the Roy G. Biv, and you got your red, orange, yellow, green, and then it goes on all your rainbows basically. So
Yes.
red light therapy is filtering out all the other colors of the rainbow and just focusing in on the red light, which has a particular wavelength. And the wavelength is just those
Okay.
units that filters just the red only. But studies have shown with red light therapy, also known as low
Hmm.
level light therapy, when applied to with within certain treatments, can help with calming down inflammation to a
Okay.
degree, can also help with stimulating uh, dermal papilla cells, which are little pillows of cells at the bottom of the follicle. If they get a little bit larger, then they can
Hmm.
support a little bit thicker hair. It also helps with vascular flow to the scalp as well. And it also helps a little bit with stem cell turnover in the scalp. So there's some benefits to doing red light therapy for that, not only just the hair, but also for skin concerns as well.
Okay. 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 So now, Um, could anyone basically order these things from online and attempt to use them, you know, for their trouble issues, hair care issues?
There are a lot of marketed units online. There are certain ones that are probably more like salon grade and any type of hair clinic grade as well. Some of the over the counter ones that are
Mm-hmm.
marketed don't have as many um, like light units on there to really be as effective as they need to be. And the other part of it is you have to also make sure that they're actually using it's a range, but usually around 595 for the wavelength in order for it to actually be true red lights and they're not just red bulbs. As I had a patient bring me
Okay.
the unit once and they just had red bulbs on them, red colored bulbs, and not actually, and there was nothing that said it was actually even a light therapy unit. It was just red bulbs. So it was marketed, but it wasn't
Wow.
actually what, in essence, really true laser low level light therapy. So
Wow.
just kind of being mindful of that and just making sure they're actually using the having the verbiage on there that it's the red light and it's filtered just the red light spectrum of
Mm-hmm.
visible light.
Okay. So, but now, could you possibly overuse it?
That's what we're still trying to understand. There's many different units, and every unit has their own way or instructions to use it.
Okay.
On
Okay.
average, I'll tell patients, they can do 3 times a week for 15 minutes. If you do
Mm-hmm.
more times a week, then do fewer minutes per session. If you're only doing it a fewer times a week, and I tell them try not to go less than three, just because they need some form of consistency, and three is really at that very low minimum. Even
Okay.
like, it's kind of like when they're doing their topicals or tablets or anything else. You really want to have consistency to be able to see the results, and you have to give it about 3 months to even start to see something because hair doesn't grow that fast. Not what's already
Absolutely.
out, but what's like because you're trying to stimulate down by the root. So it takes about 3 months for everything to make its way, or at least for it to start shifting and changing and incorporating those treatments in order for you to see the results and the benefits.
Absolutely. Okay. Okay. Well, you definitely shed some light in my me understanding the red light therapy. So at what point should she use that? What should it be prior to the shampoo? After the after the conditioning and blow dry, at what point can will be most effective?
You can use it as a pre-treatment. So that way,
Okay.
and you can use it as a couple of different ways. You can use it as a pre-treatment before you do the shampooing, conditioning, depending on how frequently the person comes. If they're coming to you like after like 5 months and they have braids in forever and ever, and they have a lot of buildup in their scalp, then that's not going to get through all that.
Hmm.
But if they come pretty routinely and they don't have a lot of buildup on the scalp, then you can use it as a pre-treatment to their shampoo and conditioning. You can use it while
Okay.
they're doing their conditioning treatments. You can also do it at the end once everything is set and styled. Just have them sit for 15 minutes under the unit at that time as well. So there's
Oh,
no
wow.
particular. There is some flexibility when the one time when it is limited. I would say it's just if there's a lot of buildup on the scalp, or of course if there's a sew-in or anything else impeding the light therapy from penetrating to the
Well,
scalp.
Dr. Nick, yes. Well, I tell you, Dr. Nikki, thank you so much for sharing on the platform. I know that you've been at it all day today doing that hair transplant. And so, but again, Dr. Nikki, I thank you for taking the time out of your schedule to share with our platform. Guys, questions that you guys may have after you guys doing the replay with this, questions that you may have, post those here, and then we would definitely I can refer you guys out to Dr. Nikki. Her information definitely I'm going to have them here in the comments so you guys can locate those as well. She does virtual consultations as well. And so, Dr. Nikki, how can they reach you?
Oh, yes, ma'am. So if anybody has any questions, concerns, want to be seen or scheduled, they can call or text 404-474-2301. That's our office number. Or they can go to our website at SOCAHcenter.com, SOCAH center.com. And of course, they can always reach out to us and follow us on Facebook at Skin and Culture and Hair Center and Instagram at Dr. Nikki Hill.
There you have it. And when I tell you, it's truly been an honor. Again, my name is Morel O'Kane. This is the platform of the hair debate. Again, thank you so much, Dr. Nikki. This is the platform where we come to debunk, debate, and discover all things hair. Yes, stay tuned. We'll share our information. Have a great night.